Is this the OT office?
Yes, come on in.
Hi, I'm Ima. Sorry about my cat.
That's okay.
The
Have
vet.
this seat here and have your cat over there.
Okay. So I just brought the assessment that you asked me to fill out, and I brought my X-ray.
Okay, and so your name is Ima Payne. Could you spell it for me, Ima?
Yep. It's IMAPAYNE.
Okay, what is your date of birth?
2/11/88.
Alright, and why are you here today?
So in December, I fell and fractured my elbow.
Okay, so that X-ray here. Looks like it's a non-displaced radial head fracture. Did they do surgery or what?
No, they gave me a splint and like some home stuff I was supposed to do.
Okay, how did those go?
I didn't do a very good job of doing my exercises or wearing that or anything because my cats are so cute. I just wanted to carry them.
Okay. So are you having any difficulties during the day with any activities or what?
Yeah, especially when I'm cooking or carrying my cats, I have like pins and needles pain in these two fingers, and then most of the time it's just some numbness and tingling. But I'm just so upset because I can't take care of my cats and love them like they deserve with the pain that I'm having.
Oh, okay.
It's also been hard to open the back door of our house with the key because the door sticks and just keeping it turned and pulling it is really hard. And it's also kind of hard, I didn't really expect it, but to turn the knobs on the oven.
Oh, yeah.
And so I usually host wine night for my friends and I haven't been able to. So that's really crappy too.
Oh, yeah. Okay. So, your list of medications here. So, ibuprofen, just
Just
one
for
a
the
day.
pain. Yeah.
Maybe the Xanax, and then NC.
Echinacea, yeah.
Yep. Benadryl.
It's organic, yeah.
Oh, okay. And then Nasonex.
Yeah, I'm allergic to cats.
Okay. Yep. All right.
And I have anxiety.
Okay. Yep. All right. Okay. So, what we will do next. Okay, Ima. So, what do you want to do for a living?
Well, I'm a little bit of a trophy wife, so I cook and clean.
Right.
Also a stay-at-home cat mom. Like I said, we have 5 cats, so it's a job in itself.
All right. What type of home do you live in?
We live in a 2-bedroom apartment. My husband and I and our cats.
Oh, okay. Any stairs or elevator or?
Nope, it's the first level.
Okay, sounds good. Well, what we're going to do now is we are going to do some measurements. What would you say your pain is at today? Just seeing how you are now on a scale of 1 to 10. 10 being we're going to take you to the emergency room. 0 being no pain.
It's probably 6.
6 out of 10?
Yeah, it's really high.
And when you're doing activities and the tingling and pins, what would you rate that as?
Oh my gosh, it's probably an 11.
An 11? Okay.
Yeah.
Yeah, that can be painful. Okay, and then are you left or right-handed?
I'm left-handed.
Left-handed,
so
and
that's why it's been so difficult to do everything.
That can be. Okay, so what we're going to do first is take some edema measurements just to check to see if you have any.
My sweatshirt.
Yeah, that would be helpful. Thank you. Okay, so I'm going to have you, we're going to just do a range of motion to see how everything's moving.
Okay.
You just copy what I do. Arms up all the way. Alright. Let me know if there's any pain in anything. Doing okay? Alrighty. Come up here. Touch your front head there. Come up here. Can rotate those hands. Okay. Flex and extend. Move all of our fingers. Make a fist. Okay. Okay, so now we'll measure. If I could have take your right hand up here. We're going to measure the edema at your elbow crease here. And we're going to measure both of them just to have a comparison. Okay. Oh, yep, a little more swollen on that side. Okay. Now we're going to do your wrist here. And here. Okay, now this hand. A little more swollen, not too bad on that side. Okay.
What does that?
All right. Have you noticed any weakness? We're going to test for that now.
Okay.
So bring your arms both up like this. Don't let me push you down here. Is that okay? All right, bring them out to the side. Don't want to push them out. Oh, that's good. And then, so you're saying you had a 6 out of 10 pain, so we're not going to really work on that arm.
Okay,
so we don't want to aggravate it too much here. Okay, next what we're going to do is our grip and pinch strength. You said you had some trouble with those things. So we have this fun machine here, and you're going to squeeze it as hard as you can. Keep your elbow tucked at your side. We're going to do it 3 times on each hand. All right, you can start with your, all right, and squeeze. Okay. All right. All right, try there. Oh, yeah. All right, we're going to do 3 on each side.
Oh, okay.
Yeah. Oh, good. Yeah. And right here. There you go. Is there pain with this?
Yeah.
Last one. Oh, good job. Oh, yeah. Okay, there we go. Next, we're going to do a single pinch like this. Just the tip of this finger and your thumb.
Okay.
Alrighty. And we're going to do each hand. 3 times. There you go. Good job. Okay, next one. Good job. Okay, last one. Okay. Okay. Next, you're going to do both of these fingers on top and your thumb. So try and keep it in that pinching. Alrighty, there we go. Next one. Oh yeah.
So many times.
I know, but it's for a baseline measurement. There you go. Okay, last time. There you go. Okay. Alright, our last one is we're going to pinch sideways, like how you would hold that key or change an arm. Okay. Alrighty. Last one. There you go. Okay. And there is that. Okay. Now we're going to do a test to rule out any other diagnosis that I might be thinking. So first we're going to do, before we do those tests, we're going to actually take your range of motion measurements. Okay, so first we're going to do your wrist, or your elbow. So if I could have this. Okay, now I'm going to have you normally be in a different position, but that's okay. Alright, to measure your extension. That looks to be normal. If you could bend it as far as you can go. Alright, so you have full range in that one. Okay, now this one. Extend it. Okay, we are at about 5 degrees. Okay, no flex here. Oh, a little loss of flexion there. Okay. We are at about 60 degrees. Okay. Well, okay, now we'll do the wrist. Okay, so normally we would have our small goniometer, but they're being taken right now by the other occupational therapist. So we're going to make do with the big one. Okay, if you can bend, flex your wrist. Okay, looks to be normal there. Okay, and then we'll extend. Okay, looks normal. Alrighty. Flex your wrist. Alright, looks like we have a slight flexion there. If you could extend. Okay, that's good there. Next, we are going to hold this pen, please. Okay, and then we're going to pronate your hand. Okay, alright. Alright, there you go. Hand the opposite way. Good, that's normal. Okay, next one. Alright, same thing. Alright, looks like we're a few degrees short. And does that cause pain there with that one?
I just don't want to hurt my elbow.
Okay, understandable. Okay, so next what we're going to do is called the elbow flexion test. And you're going to hold this position for a minute. And we'll start the timer. You let me know if you feel any change in sensation or pain, tingling, anything like that.
Already feels
It
really
does?
good.
Okay, well, alright, well then we'll stop there. Even though we didn't make the full minute, that's okay. I'm going to kind of tap here, let me know if there's any change in sensation. That was okay? Did it hurt? Okay. No. How's this one? Oh, did that one hurt? Okay. Yep. Sorry. Next we're going to do. Okay,
Sorry, it's the cat.
Oh, yeah. This is called the ruse test. So, I'm gonna bring your hands up here, and we're going to do this for 3 minutes. Let me know if you feel any change in sensation.
Okay.
Alright, it's been about 3 minutes. You did a good job.
Okay.
No change there?
No, I felt fine. Yeah.
Fine? Okay. Okay, so what we're going to do next, since we ruled out those other diagnoses, this is a sensory test to check your sensation in your hands there. So what we're going to do is, so you can't see there. What we'll start with is these little filaments, and I'm going to just tap in places, and you let me know if you can feel them or not. And then I will color in these nice pictures.
Are you doing something else?
Yep.
Yep.
Okay. Because flip them over now.
Yep. 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 You're doing it. Oh, I felt that one.
Alrighty. Next. Okay, flip them back, palm down, please. Alright.
Yep. 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 Yep.
Alright, flip over.
Yep. 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 Yep.
Okay. Flip over. Next one.
Yep. 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 Yep.
Flip over.
Yep. 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 Yep.
Okay. So here I colored in this chart of your sensor distributions, and it seems you're having some issues, especially at the tips of those, that ring and pinky finger there.
Yeah.
Yeah.
They have been really weird lately.
Okay. So our last test that we're going to do, this is called the 9-hole peg test. Alright, so we're going to start on your dominant side. So what you're going to do is pick up each peg.
Like this.
Yep, and place them one at a time in the hole.
You can't pick up two like that.
No, you can't do that. If you drop one, you can pick that one up. We'll replace it back in. You can hold this with your other hand to steady it. Okay, and then you're going to take them out one by one. Place them in there. And we're going to time each one. Okay, are you ready to be timed?
Mm-hmm.
Ready, begin. Okay. Now we'll do it with the other hand. Okay.
Do you
Ready?
have to practice again?
Sure, yeah. Yep, we'll do a practice round with this hand as well. Alright. Ready to try it for real this time? Okay. Ready, begin. Okay. Well, now we're going to do that 2 times on each side, and then
Okay.
average out the times. Okay, good job. You did both. And now we're going to average. Looks like your left hand is significantly slower than your right hand by about 4 to 5 seconds. So there's a deficit in there. Last, let's go over your quick dash, that assessment that you filled out before.
Okay.
So you scored a 50 out of 100 on the quick dash. You report severe difficulty when you put force through that extremity.
Yeah, like if I'm leaning, or that doesn't feel good.
Yeah. And pins and needle pain, that's pretty significant.
Yeah, a lot of the time, especially when I'm doing things. I put that it like affects my social activities a lot. Like I said before, that really is like a big concern of mine, and just like my daily schedule. Like I can't cook and clean and take care of my cats like normal.
Alright, so we are going to go over this handout that you can take home for some exercises and some stretches that we're going to go over. So here we have our definition of what cubital tunnel is, what we think that is kind of going on in there. We're going to try to avoid any positions that make your symptoms worse, as well as being in a prolonged bent position, talking on the phone, holding your cats, trying to put the weight through that arm. Try to avoid that for a while. We're going to go over these nerve glides. So we'll have this nice picture to go through. So 5 different positions. So here, correct, and then in like this, and up, and back out. Yes. Okay, so we're probably going to do those. We're going to do 10 repetitions 3 times a day. Get a good stretch. We're going to also work on some other activities. Like a particle bin to work on your sensory and desensitization. Some other therapeutic activities and a dart thrower's motion. Maybe throw some cat toys. Really work on that strengthening. Range of motion exercises like the nerve glides for mobility. Okay, yep, so that'll be our plan for now. We're going to go to the gym in our splinting area to make you a pillow splint that we're going to try at night here first to see if this helps. We're going to wrap some towels around to bulk up the inner elbow so you can't go into flexion or bend your elbow at night when you're sleeping, which will kind of help relieve the aggravation that's going on in there. So I'll give you this patient handout, and you can bring your cat to the gym, and we'll start with our activities.
All right, thank you.
Okay.